I was going to ask you guys a question. Now you've been students and then you've been practicing clinical associates. Now you've come back to work for university as an academic. And you are the young academics of this profession. You know, how does that feel, and how has that experience been for you?
It feels great. It feels great. Like, I feel like I've gone through certain phases, and it was good for me to come back like to the academic space, because I felt like I could influence and impact the clinical associates that were coming in a way that I thought then that this is what a clinical associate should, you know, be contributing to the communities. And then through studying as well and through empowering myself, I feel like now I can obviously do more through the years, through studying medical education. And it's empowering me to be able to train better or teach better.
No, I think what has been my main push, or my main motivating factor for coming into the academic space is not only that there's a whole lot of gratification from teaching, but also to address this particular issue of what is a clinical associate. I mean, so for example, if we're teaching students now how to perform a lumbar puncture, for example, and they don't know, do clinical associates actually perform these in the real life? What's it like exactly in the real life? So in my lessons, I always incorporate that sort of clinical, real life type of situation, that this is actually how it's going to be. I know a couple of clinical associates who are doing X, Y, Z. I've done A, B, C, D in this and that way. So it's something that I was longing for as a student. So what's it going to be like exactly, you know, once I graduate? There was no role model.
And that role modeling is important.
That's important.
So they go out there and they see nurses, they see doctors, but they don't see enough clinical associates for them to learn how to be like or what to do.
So you guys are their role models right now. As a clinical associate, they look to you saying, well, you've been in practice.
I guess I just described that, didn't I? Without even realizing
just
it,
like
but
we were teaching year 3 skills review today.
Yeah,
I mean, you were teaching the counseling components of this and how to be a good clinical associate counselor to a patient, and you were role modeling that.
Yes. Yeah. I mean, I'm hoping that, I mean, a lesson is better learned from your role model than a person who's not. You know, so. Yeah.
Sure. Why did you guys all get into this profession when you're all PAs? So
Yes.
Why did you become PAs?
I give a different story all the time. So.
Why?
It's just because there's so many reasons. I think when I first said in Dr. Truscott's class that day, I think I said the story of yeah, there was we had at home, we had chickens. We had outside rooms, and there was a toilet outside. We used to sleep in there, in this outside rooms, in the staff quarters. It's those traditional old housing. There was a toilet outside, so one of the chicks, or a couple of chicks actually, fell in the toilet, in the bowl there, and some of them drowned. I used to watch Baywatch with Pamela Anderson.
Oh yeah.
Goodness.
Back then, and I saw CPR for the first time in Baywatch, and I did CPR in a chick. On chicks. One survived, one died. One died, one survived.
You're resuscitated.
Oh my goodness.
I made for this.
That's great.
And when I performed CPR, or when I resuscitated a couple of patients at Carltonville, I remember it was the second one after I had completed my ACLS course. First one didn't go successfully, the second one was. And I thought, but I was made for this. And I realized this when I was 7 years old. So that's why we're here. I'm here because of a chick that I did CPR on.
To save lives. That's great.